Hello everybody, welcome to our presentation on Henry Cho. My name is Euan.
And I'm Sam. So a little background on Henry Cho. He is diagnosed with non-Hodgkin lymphoma. He gets night sweats and trouble breathing. He is currently on chemotherapy and radiation treatments. No one in his family history has been diagnosed with cancer except for his grandfather, who had been diagnosed with pancreatic cancer.
So our treatment will be utilizing monoclonal antibodies. These were designed to attack a specific target antigen, and these are delivered into a vein via IV. Our specific drug is called ibritumumab tiruzitam, and the commercial name is Zevalin. The antibody is attached to a radioactive molecule. The antibody then attaches to lymphoma cells. This treatment has side effects including nausea, fever, rashes, and fatigue. We administer anti-nausea medications before every infusion. The patient should stay hydrated to prevent radiation damage to healthy cells, and the patient should eat in small increments rather than 3 big meals while the treatment is ongoing.
Our clinical trial for Zevalin is testing on males aged 10 to 17. The benefits of this treatment is that we will get accurate results because we are using direct testing on humans rather than testing on animals. Some risks of this treatment is there have been known deaths within 24 hours. The patient may get nauseous, they might get a fever, rash, or fatigue, and there's also radiation involved.
We will administer the IV infusion into the arm vein. The drug will target all B lymphocytes. Antibodies bind to radioactive molecule and then attach to B lymphocytes. The antibody will bind to the CD20 antigen found on the surface of normal and malignant B cells. This process allows radiation from the attached isotope, mostly beta emission, to kill a cancer cell and some nearby cells. The antibody itself may trigger cell death via antibody-dependent cell-mediated cytotoxicity, complement-dependent cytotoxicity, and apoptosis.
The goal of this clinical trial is to determine the effectiveness of Zevalin in males aged 10 to 17. The hypothesis we propose is if the therapy kills all B lymphocytes, then we will know that all the cancer's B lymphocytes have been removed and the treatment was successful. The reason why Zevalin is better than traditional chemotherapy is that it's a more specific treatment and it targets one type of cell that is causing the cancer, which is the B lymphocyte. This minimizes damage to other cells of the body, and we can more effectively remove the cancer. And after this treatment, we will allow the B lymphocyte population to naturally grow back from the bone marrow.
In our study, we will take a sample of 100 adolescents affected with non-Hodgkin lymphoma from age 10 to 17. We will prepare 50 IV bags with the Zevalin and 50 IV bags with the placebo. We will make sure that the bags are identical with no marking of Zevalin or the placebo. We will randomly assign an IV bag to every subject, administer anti-nausea drug prior to IV infusion, and infuse daily for 7 days, duration 10 minutes each. After 7 days, we will record the results and observe any significant differences between the patients.
During the course of selecting subjects, we want males aged 10 to 17 that are diagnosed with non-Hodgkin lymphoma. The patients must have normal platelet counts and healthy bone marrow and lymphocyte production. They should also have no other current medical conditions.
We will stop the infusion if the patient shows severe reactions, and we are going to check for leakage of fluid at the site of infusion. And if we discover this leakage, we will restart the infusion on a different limb. The dosage will not exceed 30 millicuries of radiation. Thank you for listening to our presentation.